Hello everyone, once again thank you for joining my YouTube classes. Today this is one of the most documentations that I've been getting in my comment section about how to do the newborn examination documentation. So we have so many pages over here and we are going to learn how to fill it. It's one of the easiest documentation you will ever get in the midwifery or ski, trust me on it, because once I show you, you will know. So let's go straight into it. Yes, welcome back. So on the documentation for the newborn examination, you are done with your assessment. So now you are going to document. I will always advise you document before you give health education, because the documentation is very important to the team. If you do a lot of talking and documentation, you don't you do a lot of talk and health education, you don't document, then you are going to be in trouble. You can easily fail, because documentation is very important and critical in the examination. So no abnormalities detected. We can see they have also listed all the assessment that you would have done and the abnormality detected follow-up required. So they are saying please tick. So all we need to do is in your assessment, tick. That is, if you have done all these, tick. How nice is it? So easy, isn't it? So once again we tick. How nice. Tick and tick. Let's go to the back over here. So we're on the last page. Tick. So this is when during your assessment everything is normal. There are no abnormalities detected. Everything is so normal. Now let us talk about this most important part. This is what will tell whether you fail or pass. You see, they say the conclusion at time of examination. Here it is asking you conclusion, recommendation, follow examination, physical, psychological, wider sociological factors. So what have you done during the newborn examination? You reviewed history, you identify risk factors, you did the head tutor examination, you did the NIP, you also gave education, and you gave a follow-up appointment, isn't it? So this is what you write. Systematic examination of the newborn. So I'll just write systematic examination of the newborn on your day of examination. So let's say the date of MRI examination, is today, 8th of October 2024, including 9P of whichever you did. Maybe I did hip and testis. Of hip and testis. Full stop. During my assessment, did I identify any risk factor? No. So I just write no risk factor identified. Is there any follow-up appointment? Yes, because I did my assessment, everything was normal. So my follow-up appointment is going to be 6 to 8 weeks by the GP. So I continue to write follow-up appointment in 6 to 8 weeks by GP. So now let's look at it. Conclusion is what I've done. It's saying recommendations is going to be follow-up appointment. Sociological factors, that was if there was any risk factor identified. There is none. Now this second one is asking us parental participation health promotion point. Sorry, during your assessment, did you do any education, or are you going to be talking about any education after the documentation? Yes. What documentation are you what education are you going to be giving your patient? So let's say I will want to educate my patient on sleep safety. I also want to educate my patient on safety checks. I also want to educate my patient on car safety. I also want to educate my patient on illnesses. Oh, what have I spelled? Illness. Yeah, so illnesses in newborn. Then what education? Probably I also want to talk about responsive feeding. So these are the points of the education I'm going to give. However, I'm going to be talking on it to the examiner and also to the patient and midwife's name. So let's say it's me, Anita. I'll always print your name this way. Signature, let's say signature is this, and date of my assessment, which was 08/10/2024. So over here I wrote 24, which is ridiculous. 2024. Yeah, so sleep safety is when you want to educate patient on that patient should always ensure baby. So when it comes to the education, let me quickly touch on it. Sleep safety is when you want to educate patients on that she should always ensure that baby is sleeping in the cot. She shouldn't put any nappy bags in the cot when baby is sleeping. You should always ensure that baby is sleeping on the back. It's fine if she's doing skin to skin. However, if she's feeling tired, she wants to have a quick rest, she should put baby back in the cot so that she can have rest. She shouldn't co-sleep because we are trying to reduce the risk of babies getting sudden infant death syndrome. Then we have the safety checks. So the safety checks is ensuring that your thermostat is working in your house, the room temperature is okay, the place is not too hot, the baby's cot is not too warm, you are not using over clothing, high clothing, thick clothing to make baby too warm. You're ensuring that your fire safety checks are done regularly. You are also ensuring that your smoke detectors are working, your boilers are working and not faulty, and detecting any harmful chemicals like the monoxide, the carbon monoxide, which is quite dangerous. So the safety checks is basically ensuring that everything is kept in place. Also ensuring that your chemicals, your detergents are in its actual containers and they are hidden away from reach, because now you are bringing a baby. So these are the safety checks you want to talk about. Then when it comes to car seats, car safety is ensuring that a baby is having her own car seat. You wouldn't want to put a baby straight in a car, or do not put a baby on your lap in the car. Baby should have a car seat and well fastened. And when we come to the illnesses in newborn, it is letting mother know the illnesses she can pick up when her baby is unwell. For example, baby looks lethargic, baby is too tired to feed, baby is floppy, her tone is poor, she's not active, baby is given either an extremely low pitch cry or extremely high pitch cry, which is unusual from what you usually do. So that is what we call identifying illnesses in newborn. Then we have the responsive feeding. So responsive feeding is not you telling a patient to breastfeed. You can't tell a patient to breastfeed if she does not want to breastfeed. However, it is the education that you are giving to the mother that irrespective of the kind of feeding she is going to give to her baby, she should always feed on demand and frequently. Also, she should ensure that she's watching out for baby's feeding cues. When your baby wants to feed, how does baby react? Is it that baby jeer her head more towards your breast or more towards the angle that she's always in when feeding? Is it that baby cries, wiggles and all those things? She's looking for the teeth to just suck on, or the tongue. When you stroke the cheek, she's just sucking the tongue. All these are examples of feeding cues. So it's like, what does your baby react when baby is feeding? So those are feeding cues. So educating mother to feed when baby is feeding, feeding on demand, feeding frequently, and watching out for baby's feeding cues. So these are what you want to talk about. Don't give education on mother because you are referring to baby. This is a newborn examination. Some people will talk about perineal hygiene here, exercise, like, hello, this is a newborn examination. You can't be writing on education for mother. If you are doing postnatal check, then you can talk about those things. But this is newborn examination. All the education needs to be about mother. So this is how the documentation for the newborn examination is going to be. Very simple, very straightforward. If there is any what do we call it, any question, please pop it in my comment section. I'm happy to review it and also reply to any queries. Yeah, that is it. I hope this class has been super helpful. Thank you so much for joining, and I'm trying to speed up so that my daughter doesn't shout. Yeah, so please do enjoy, and I hope this documentation has been super helpful. Thank you, and enjoy the rest of your day. Bye.